Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hello all, I am Dr. Bhaskar Thakuria. I am a medicine specialist. I have studied at Guwahati Medical College, which is situated at Assam, and I have been practicing medicine for last 20 odd years. I am presently associated with government service. I work as Associate Professor of Medicine in Nalbari Medical College, which is a newly formed medical college in Assam.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Okay, so hypertension is nothing but high blood pressure, which is above the level which is being fixed by international hypertension associations. Even if we feel normal, the blood pressure should remain under control by regular monitoring with physicians, because blood pressure is such a disease that the effects of it on the organs inside the human body, like the brain, heart, kidneys and blood vessels, it keeps on happening even when the patient is not feeling anything. Only when the damage or the changes because of hypertension being present in the body for a long period of time that the patient starts developing issues. But then till that time the disease takes a advanced course. So it is very important that even if the patient does not feel any issue at this moment, he or she should not think that hypertension is not having its effect in the body. They should always go to physicians or doctors at their prescribed advice time for regular follow-up and monitoring and advice.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
It is related to what I have just told you. As because hypertension causes effects by having chronic changes in the blood circulation and the blood vessels that supplies a good amount of blood to the major important organs in the body, like the brain, heart and kidneys. So the changes occurs in the organs because of the less blood supply, because of atherosclerotic changes of the blood vessels. As because these changes keeps on happening even before the patient does not experience any affection, any symptoms as such, that's why it is known as a silent killer. It keeps on doing its work silently without much knowledge to the patient.
So, doctor, I would like to know, what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle or something else?
Hypertension is one of the very common afflictions of the modern age, and as like any other modern day ailment, it is intricately related to the modern lifestyle, which is associated with good amount of stress, which is very evident with other lifestyle diseases like diabetes, dyslipidemia, etc. So hypertension also forms one of the components of the metabolic syndrome, which also has many other components in the syndrome, and they all work towards causing the major organ system dysfunctions in the body. As they are, it keeps on happening in the modern lifestyle. As I said, definitely the modern lifestyle and the stress associated with takes a big role to play. So also the eating habit and the other sedentary lifestyle does take a toll on development of hypertension. Having said that, yes, hypertension also have a genetic component. It is said that if one of the parents of a person is or was hypertensive, then the chances of developing hypertension in that person doubles. And if both the parents are hypertensive, then it becomes it quadruples. Therefore, it is very essential that to take family history of hypertension whenever we physicians deal with patients for any ailments or for any symptom. And then if either one or both parents is hypertensive, then we ask for frequent checkups of the patient at specified period of time so as to catch hypertension at the earliest possible time.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
So blood pressure traditionally is described or expressed as a two numbers. As two numbers, it is being mentioned. One is the on the top, which is known as the systolic blood pressure, at bottom, which is known as the systolic blood pressure, and the one at the top is known as the diastolic blood pressure. So these both the two components of the blood pressure expression are important for normal functioning of the human body, and both these components should be normal. As per the different associations, it has been agreed upon at present that 120 millimeter of mercury systolic and 80 millimeter of mercury diastolic is considered to be normal, and if this goes above 130 by 80 millimeter of 130 by 90 millimeter of mercury, we consider it to be hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
As I said, hypertension has its root at the modern lifestyle and the stress and dietary habits associated with it. So first and foremost, whenever a person is diagnosed with hypertension, we outrightly do not prescribe them medications. We first prescribe them certain dietary counseling as well as certain lifestyle changes which are very essential, which go in handy, and they should be practiced right from day one, and it should continue even if the person is being advised to take medications or not. With regard to dietary advice, first and foremost is to decrease the salt intake, which decreases the amount of sodium in the diet. Secondly, we should increase those food components in the body which increases potassium. Decreasing the sodium and increasing the potassium goes in a very long way in decreasing the hypertension to a significant amount, even if the blood pressure medication is not started with. Along with that, also regular moderate exercise is one very important component of non-pharmacological therapy. With regard to regular physical activity, the most important that we always advise the patients about is known as brisk walking. They can also do, these are known as aerobic exercises, either brisk walking or swimming or jogging or stretching. Or jogging, and then strength training or stretching exercises also are important, but then more important is the aerobic dynamic exercises. It should be done for 150 minutes in a week's time.
Can we say that hypertension can be treated without medication?
As I said, whenever a patient is first diagnosed with hypertension, we definitely prescribe them dietary advices, which is known as dietary advice to stop hypertension or DASH diet. DASH diet is such where the calorie should be low, the potassium content should be high, sodium content should be low, and also there we are supposed to ask them to take a low calorie diet. Along with that, it goes in goes hand to hand is the amount of aerobic exercises that I just mentioned. Along with that, we need to also address certain other factors as well, like the patient should be asked to stop or quit smoking altogether, and patient should be asked if they cannot stop but to take alcohol in moderation. And what is the moderation amount of alcohol? It is 2 packs, standard packs a day, for less than 2 standard packs a day for man, and less than 1 standard pack a day for female. But then if it can be stopped altogether, it is definitely more good. So all these factors taken together goes in a long way to decrease blood pressure in the initial days, but then many a time what happens is that they do not suffice. In that case, which continued advice for continuing all these three modalities of treatment, as I said, patients have to be given certain antihypertensive medication as per the patient class the person belongs to.
Okay, doctor, you just talked about medication right now. So I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
We prescribe antihypertensive medications of different classes to different groups of person, as I just now said, and deciding upon which medication the patient will have to be on to or started with, it depends upon the patient profile and many other factors taken together. We need to consider about associated diabetes, associated dyslipidemia, and many other factors together. And depending upon that, we start with the medications. As I said, that medication belong to different classes, so also the side effects become different for different class of medications. Like in case of calcium channel blocker, which is one of the commonest prescribed medication as antihypertensive, their commonest side effect is swelling of the legs. Then another class of drug which is known as beta blockers, they are associated with fatigue, undue fatigue in some patients. And then there is another class of drug which is called as diuretic. They can cause disturbance of the salt equilibrium in the body. But then having said that, it is also very important that general public should not be, though they should be made aware of the possible side effects of the class of medication used by the physician, but they should not be unnecessarily afraid of the side effects. The side effects, first of all, does not occur in all the patients, and even if it does occur, it can be managed either by changing the class of medication or changing the dosage prescribed for the person concerned.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
This is again a very individual patient based phenomena. It is not that it can be a blanket opinion for each and every patient. If the patient is very motivated for the lifestyle changes that I have just now said, which encompasses stopping smoking, moderation of alcohol, daily brisk exercises on 150 minutes a week, and then dietary changes. If the patient is very motivated and they stick on to it for a long period of time, yes, in that case, many a person can definitely, along with that, I forgot to mention weight reduction for those patients who are overweight or obese patients. So if all these things can be achieved, or the patients can stick onto this for a long period of time, yes, in certain percentage of patients, we can withhold the medication. But for most of the patients, even if these lifestyle modifications are adhered to, their BP control is not enough only with this. In that case, antihypertensive medications have to be given, but then it is for sure that those people who do not cling on to the lifestyle modifications, the antihypertensive medication doses has to be more in those patients, whereas those patients where lifestyle modifications patients are very compliant to, their medication doses can be reduced to a significant amount.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off on this podcast, Win Over Hypertension.